Hi guys, welcome to my fourth and final September video to help you student nurses get ready for starting your nursing degree. And this video is going to be about basic acronyms and abbreviations that you'll hear in nursing all the time. Now there are hundreds of these, and I have done another video about abbreviations ages ago. I can't even remember what's on it, to be honest, and I will do more of these videos, but in this video I wanted to do 30 basic abbreviations. So some of these, if you're a healthcare assistant or you've worked in healthcare before, you'll know these, but if you're completely new to nursing and nursing degree and hospital setting, you might not know what these are, and it's really helpful just to have a basic grasp of the most common abbreviations and acronyms before you start. Let's jump right in. HR, heart rate, is part of your observations, and it is the amount of beats your heart beats per minute or per 60 seconds is your heart rate. HR. RR, respiratory rate. Very similar to heart rate, the amount of breaths you take in and out is 1 breath per 60 seconds per minute. Your respiratory rate, again, part of your observations. BP. Now this is quite a common phrase that most people know, blood pressure. Again, part of your clinical observations. You might also have people that refer to OBS, or you might have written down OBS, OBS. It just means observations. It's just a shortened version of that. D and V, diarrhea and vomiting. So you might say that a child has D&V, or you might have a handover note saying the patient's diagnosis is D&V. It means that they've come in with diarrhea and vomiting. Next up, HO or H/O. You might see this again on handover paperwork. It just means history of. So when you're getting a patient's medical history, you'll put H/O and then write their history, or a doctor might do that and you might see it written in their notes as H/O. NBM, very common one, nil by mouth. You'll get this in pre-op patients that are nil by mouth because they're going into surgery. TPR, this is again part of observations, and it's temperature, pulse and respiratory rate. And so you can have HR, RR, BP, but TPR is kind of, you might just be asked to go and do a patient's TPR. It just means that OBS, basically the temperature, pulse, respiratory rate. It's just another way of saying it. NG or NG tube will be nasogastric tube. It's the most common type of tube that you have for enteral feeding of children. It's a tube that goes through their nose into their stomach to feed children for a variety of different reasons. But it's good to know if you come across the term NG tube, or you see it in the notes that that child is being fed through a tube through their nose into their stomach. WOB means work of breathing. It's how hard a child is working to be able to breathe. Kind of related to that, RDS, respiratory distress syndrome. Now if a child has is working very hard to breathe, they're in respiratory distress, and it kind of comes in as RDS, respiratory distress syndrome. Now you might see HT and WT on forms. It just means height and weight. It's just a shortening way of saying it. And you might see IV or IVABs or IVAB, or you might hear someone say IVs or IVABs. It just means intravenous, or IVABs is intravenous antibiotics. IM is intramuscular. It's a type of injection that goes into the muscle. Most vaccines are IM, and sometimes you'll give antibiotics IM for various reasons, and hormonal therapies and things like that. SOB, similar to what we were talking about before about the work of breathing. SOB is shortness of breath. So you know the saying, when you're short of breath, you know what being short of breath is, and so sometimes that will be abbreviated to SOB. T and A, again, you might see this on handover notes or surgical notes. It means tonsils and adenoids, and if they've gone to have their TNAs removed or TNA surgery, it means tonsillectomy and adenoidectomy. So your adenoids are in your nose, tonsils are in the back of your throat, and it's when both of those are taken out, your tonsils and adenoids. UTI, very common one in paediatric nursing, urinary tract infection. Many babies come in with UTIs, and children as well. FBC or FBC in U&E. Now FBC is a full blood count. It just is a blood test to test a variety of things in your blood, like hemoglobin, white blood cells, things like that. It's called full blood count FBC. UNEs is urea and electrolytes, and it tests your urea and electrolytes in your blood. So a lot of times a child will come in for blood and they'll want an FBC and UNE. You'll hear it a lot on like Holby City and Casualty and things like that, and that's what it means. TTAs, you'll hear this a lot when patients are being just discharged. It's to take away. So it's medication that they need to take home with them. So if they're going home on antibiotics, if they're going home on inhaler or steroids or anything like that, they'll have a TTA that will come up from the pharmacy, and then we'll give that to them and they'll be sent home with that. It's called a TTA. ENT, now this type of specialist, it's very common again in paediatric nursing, ears, nose and throat. So you might have an ENT doctor, or they'll need an ENT assessment, or they're waiting for ENT, or you might have it on paperwork, ENT, that's what that means. Now NAI is non-accidental injury, and so you'll get this on forms quite a lot. It'll have query, which will be question mark, NAI. And when they say query, it means they're not quite sure, but maybe NAI, non-accidental injury, and this is indicating possible abuse, basically an injury that they have that might have been done on purpose, non-accidental injury. It's a safeguarding concern. We'll put it on forms as NAI to kind of protect confidentiality, and to kind of, we know what it means, parents don't know what it means, that kind of thing. But if you see that on the form, that is what it means. SW means social worker. HB means hemoglobin. Hemoglobin is the amount of red blood cells that are in your blood. So HB is tested as part of the FBC, but a child might come in with like low HB, which kind of anemia, basically. They might have a blood transfusion. You get it a lot in sickle cell anemia. Obviously you'll want to know the HB count for that, and things like that. It's quite a common acronym, it's quite a common thing to come across. Now BO or BNO is bowels opened or bowels not open. Now as paediatric nurses, we like to know about bowel and bladder habits, and it will be something that you ask and need to not get embarrassed about asking on a regular basis. Are their bowels open? Are their bowels not opened? We need to know if they're constipated. We need to know if they're opening their bowels a bit too regularly. So on forms you'll have bowels open, BO or BNO, and if you're BNO for days and days and days, that's something to kind of worry about, and maybe they need to have a bit of laxative. On a similar note, PU is passed urine. Again, passing urine is very important. We need to know that they're passing urine regularly, when they're not passing urine, if they're passing too much urine, how much urine they're passing, especially if you're doing a strict fluid balance. So sometimes if you're not doing a very strict fluid balance, you might just write PU to just show that they've passed urine. You don't need to measure it, but when you're doing a strict fluid balance, you'll do PU, and then you'll tell the amount of mils specifically that they have passed, and you'll also be recording the amount of mils going in and what they're drinking, water, milk, whatever it is, to give that fluid balance. CXR is chest x-ray. DX is diagnosis, so you'll have that on forms, DX, and then it'll be like DMV or bronchiolitis or type 1 diabetes or whatever. And lastly, quite a common one as well, NSAIDs or NSAID and then a little S. NSAIDs are non-steroidal anti-inflammatory drugs, and most of the time this means ibuprofen. It's anti-inflammatory drugs that do not contain a steroid, so ibuprofen is an example of that. So as I said, there are loads and loads and loads of abbreviations, and you'll be bombarded with them when you start placement and at university. I can't possibly tell you them all. If you've got things that you don't understand, look them up online, ask someone. People don't mind, especially in your first year, first placement, if you say, oh, actually, I don't know what that means. Can you explain that to me? Things like that. And especially on the handover forms, because those can be so confusing, just full of abbreviations and jargon. So ask for help, and I hope this video helped you, to give you a little bit of insight. Kind of, it's helpful maybe even to keep a list of abbreviations in your pocket, to write things down when you don't understand, to ask at an appropriate time. You will get to know it, and it will just become second nature, and you'll be the one saying all the abbreviations and jargon, knowing exactly what you mean, when other younger students, first year students, have no idea what you mean. And so we've all been there, and you'll do great and you'll do fine, and I wish you all the best. Let me know if there are any other videos related to being a student nurse or related to university or placement that you want me to make, and I'll slot them in. You know, September was the kind of university month, but I will obviously make my main target audience is our students, and trying to kind of help you through your degree as much as I possibly can. So if I can help at all, please comment below, suggest video ideas for me, and subscribe if you want to stay tuned for more, and I'll be delighted to have you. Good luck and all the best for your nursing degree. Bye.